respect and cooperation between foreign-born and U.S.-born Americans. In other words, foreign-born illegal aliens are now foreign-born Americans. We've gone from illegal immigrants to undocumented immigrants, and now they refer to them in the welcoming America, welcoming cities as just simply newcomers. This is not something that's limited to Austin or a few states like Michigan. No, this is national and it is international. They say that stakeholders will be participating in national and transatlantic learning exchanges to learn about global practices. And of course, this organization is supported by internationalists and globalists like the Intercultural Innovation Partnership. That's the UN, the United Nations Alliance of Civilizations, and BMW. Also, organizations like Carnegie and Western Union. And one of the organizations involved with funding this is the German Marshall Fund, which frequently talks about Atlanticism. This is a globalist agenda. They talk about it as not being an agenda like Agenda 21, because that's gotten kind of a bad rap. They talk about it as being a framework. But this framework is not grassroots. It's coming from the globalists. Here's what they're talking about as part of that framework.
And in this summit, some of the things that we're covering is where this morning we talked about the economic impact of immigration. We had city demographer Ryan Robinson come and talk about Austin's multicultural future. In other words, how we're growing as a community, what ethnicities are influxing and diminishing, and how we're growing. Then we're also having career pathways for new Americans. Tomorrow we're having best practices in immigrant integration. We're having a specific section on executive action for employees and employers and how that affects the employment environment. We have one on Austin and immigrant rights, a local perspective from immigrant rights organizations.
So it's a very well thought out agenda, just as we see in these Delphi techniques where they present Agenda 21 to people locally. They say, we want to work with you to help you figure out how to do whatever it is that you want to do in your community. But of course, this agenda has already been worked out, especially with things like, did you catch what she said, executive actions and how they affect the employment workspace between employees and employers. In other words, Obama's DACA, his Dreamers, his amnesty. How does that affect people? Now, we know that since 2000, virtually all of the new jobs, the number of new jobs that have been created, are the same as the number of jobs that have been taken by immigrants, legal as well as illegal. So in other words, for native-born Americans, there's been no increase in job opportunities. There has been a decrease in wages, a decrease in purchasing power, and there will be a massive increase in taxes that we're going to see come along to pay for this entitlement program. So while we as native-born Americans are seeing fewer job opportunities, no job growth, we're seeing higher unemployment as well as higher taxes. She talks about career paths for immigrants. Listen to how she spends this. So what kind of career paths are we looking at that's different?
Well, I think it's just more. Part of the careers are like STEM and tech fields. I mean, here in Austin, many of our new techpreneurs are actually foreign-born. It's like I think approximately 25% of techpreneurs in Austin are foreign-born. Other pathways might be.
Is that typical, or is that?
We have a high number. We're very lucky. Actually, I think we're the highest number in Texas.
Are those illegal immigrants, or are those people who are coming here because their employer has brought them in into the tech companies?
So they're coming with tech companies for the most part, or on special entrepreneurial visas.
Okay. And when you're talking about immigration rights, what type of things are we looking at? What rights?
We're talking about, in general, how immigrants are treated in Austin, and how wage theft, issues like that.
So you see, she's muddying the water by talking about tech immigrants who have come here legally, brought here by their companies who fill out the paperwork, avoiding the topic of the massive influx of people that they're enticing to come in to go on to the welfare state, to see themselves as entitled to become dependents of native-born Americans. In terms of rights, though, I mean, when somebody comes here illegally, what type of rights do they, do they have the right to stay, the right to, what do they have a right to? They have a right to education?
I'd say that, so I think that as a community, we can all agree that anyone who lives here has a right to be treated well. And that's the rights that we're focusing on, that right to be treated well.
So she says this is just about treating people well. That's not true at all. At this seminar, they're talking about how they're going to get driver's licenses for illegal immigrants here in Texas. And of course, we've seen in other states how they're giving non-citizens the right to vote. You can't go into any of these countries. I can't, as an American citizen, go to Mexico and get a driver's license, vote there, get a free education there. This is a globalist agenda that is aimed at all Western countries, using compassion and treating people well, talking about multiculturalism, but it's designed to destroy the countries economically by entitlement programs that are unlimited and by totally open borders. For INFOWARS Nightly News, I'm David Knight. Now, of course, Welcoming America is saying, according to their statement of principles, that they believe the majority of U.S. residents are empathetic and compassionate people. Now, notice that they said residents, not citizens, because we've gone from illegal aliens to undocumented to now residents, and their favorite term at Welcoming America is newcomers. They say that we must treat all of our neighbors with respect and decency. Who would disagree with that? But is it respectful to come here and ignore our laws and demand entitlements? Look at the story from the New American, talking about the cost of schooling. We will lose our homes through unaffordable property taxes if there is no limit to the number of children who can be brought into America with open borders and entitlements. They have the city mayor of Lynn, Massachusetts, said she was so concerned about how to pay for schools that she went to Washington asking for help from federal officials. And this is what she said: "I love the fact that Lynn is a diverse community. By speaking out about this, I've been called a racist. I've been called a hater. That's not the case. I'm simply looking at this from the point of view of the economic impact that it has on my city." And that's the point of view that the globalists who are funding organizations like Welcoming America, like Welcoming Cities and Counties, the globalist organizations in the UN that are funding this kind of Agenda 21 approach, they understand that we cannot afford it. That's why they're doing it. Stay with us right after the break. Rob Dew takes a look at another outbreak that shows the ineffectiveness of the flu vaccine, this time on a Navy ship. Stay with us. We'll be right back.
Introducing Secret 12, the new INFOWARS Life vitamin B12 formulation. Most forms of vitamin B12 are highly processed and synthetic and cannot be properly absorbed by the body. That's why for real results, so many are having to turn to painful B12 injections, which are known to have higher absorption rates. Now, InfoWarsLife.com is excited to announce that we can bring you our most bioactive, powerful form of B12 that has been developed with our exclusive perfected process. Secret 12 is a binary of nutramedical grade, bioavailable coenzyme forms of B12, methylcobalamin, the same kind used in B12 injections, and adenosylcobalamin. Secret 12 is simply taken by mouth, right on the tongue, and then swallowed. No needles, no injections. Don't take my word for it. Try it for yourself. Discover the secret. Secret 12. Secure your revolutionary Secret 12 formula right now at InfoWarsLife.com or call 888-253-3139.
The average person's life is filled with unexpected challenges. Unlock the energy it takes to defeat these daily beasts with super male or super female vitality, specifically designed to assist the body in regulating proper hormone balance to create superior vitality in males and females. Supercharge and conquer your world at InfoWarsLife.com or call 1-888-253-3139.
Rob Dew reporting for InfoWars Nightly News and Infowars.com with another vaccine report. This one comes out of Canada, but it also leads back into the United States. And this is out of the Globe. Canadian study finds flu shot could increase risk of getting sick. Wow, something we've been telling you all along. Now, it's in a study, and scientists have said it, so now we can all believe it. The study states, in particular, vaccine effectiveness against influenza A among those who received the 2014-15 vaccine without prior vaccination was higher at 43% than among those participants who were vaccinated with the same vaccine component in both 2013 and 14 and 2014-15. And they're saying it was negative 15%.
For those who received this year's flu shot alone, the vaccine appeared to be quite effective, about 43% effective. But if the patient had a flu shot in both years, both this year and last year, the shot was actually negatively effective, meaning it may have made people more susceptible to the flu.
You're at a 15% increased chance of getting the flu if you got the vaccine in 2 years. But they didn't do a study for 3 or 4 or 5 years. Of course, we'll never see those, what the chances are, but at least we know they are doing something. Here we go. A negative effectiveness suggests the vaccine made people more susceptible to flu, Dr. Dickinson says. We need to do further research to understand why this has happened. Well, the vaccine attacks your immune system. That's been proven many times over. So by taking it twice, you're attacking your immune system twice, thereby increasing your chances of getting the flu. But then again, I'm not a doctor, so you shouldn't trust a thing I say. You should do your own research. Similar results were also found in the United States. More than 3/4 of flu vaccines this year have been ineffective, reports the Daily Mail. The percentage of effective injections at 23% is one of the worst performances since the government started tracking how well flu vaccines work in the 2004-2005 season. So in the last 10 years, this has been the worst they've ever done, or maybe it's the best they've ever done if that's what they're looking to do, is get people sick. Furthermore, in both of these, they said seniors were always the least protected. But if you go to flu.gov, which is a website run by our federal government, because your immune system weakens as you age, adults age 65 and older are more susceptible to the flu. It is important seniors get their flu vaccine. It seems seniors, children, and pregnant women are their targeted groups for flu vaccination, but they've known it hasn't worked for elderly people for a long time. In fact, here in 2013, USA Today reported flu vaccine barely worked in people 65 and older. This season's flu vaccine was completely ineffective in people 65 and older, which could explain why rates of hospitalization and death have been the highest ever recorded for that age group, according to early estimates released by the Centers for Disease Control and Prevention. For those 65 and older, though, it helped in just 9% of the cases. But even back in 2013, they knew if you got the flu shot 2 years in a row, your chances of getting the flu increased. Effectiveness of flu vaccine raises more red flags, and this is dated 3/26/2013. The influenza vaccine was 62% effective among people who did not receive a flu shot in the prior year. In comparison, vaccine effectiveness among those who did get the flu shot in the previous year was substantially lower at -45%. So you're almost a 50% chance of getting sick from the flu if you got the vaccine in 2 years. That would have been 2013 and 2012 flu seasons. In 2010, PLOS Medicine published an analysis of Canadian epidemiological studies suggesting that people who had received seasonal flu shots the year before the 2009 H1N1 pandemic had an increased risk of becoming infected with pandemic swine flu. A second study in 2009 identified similar associations between previous vaccination and pandemic H1N1 illness in a military population. Between April 21st and May 8th, a total of 97 patients developed the H1N1 virus. Of these 63 people, 66% had received the influenza vaccination in the previous 12 months. In comparison, only 40% of patients without H1N1 virus had no history of vaccination. And when you're in the military, as Joe Biggs and others have pointed out, you really don't get a say in what you get to put in your body. In fact, you get no say whatsoever. They tell you to line up and they give you whatever flu shot that year they think you need. And look what happens when the armed forces does get herd immunity. Here we are, February 24, 2015. CDC admits flu vaccine does not work. Influenza outbreak on fully vaccinated Navy ship. The CDC published a report documenting an influenza outbreak which occurred among fully vaccinated Navy personnel aboard the USS Ardent, a U.S. Navy minesweeper moored in San Diego, California while conducting training. And here's the CDC's reports from February 2014. Influenza outbreak in a fully vaccinated population, USS Ardent, February 2014. Naval Health Research Center determined that 20 specimens were influenza A, of which 18 were subtype H3N2. The HA gene sequence of the outbreak isolate was 99% identical to the strains circulating during the 2013-2014 influenza season and antigenically similar to the H3N2 component of the 2013-2014 influenza vaccine. At the time of the outbreak, 99% of the crew had received influenza vaccine. And 17 of the 18 crew members with confirmed influenza A H3N2 infection had received the 2013-2014 influenza vaccine less than 3 months before the outbreak. Just another case of the flu shot causing the flu. And now we go back in time to 2011. The Centers for Infectious Disease Research and Policy, or CIDRAP, released this article, Flu Vaccine Efficacy, Time to Revise Public Messages. And they are basically reporting on a Lancet article, and they found little or no evidence of the 70 to 90% efficacy for most population groups, which is what they always say. The flu vaccine is 70 to 90% effective. They found nothing of the sort in that. In fact, they found it was close to 59% in adults younger than 65. And we know what happens once you get 65. And now I want to end with a couple articles from Mercola.com. The first one is in 2012 and the second one's in 2010. Here's the first. Analysis finds flu vaccine efficacy lacking as flu vaccines are suspended across Europe and Canada. That's right. In this article, it talks about several different companies